sessions about financing health innovation. And I'm very honest and very pleased actually to welcome Iñaki Gutierrez Ibarluzea. Hello, Iñaki.
Hi, how are you doing?
Very happy to welcome you again in one of our sessions. I've had the great pleasure to know you for many years, and I know how your activity are very impactful on health. So very happy, and thank you again for joining us today. I think we're going to have a very interesting session today, speaking about public health priority for innovation. So as you know, for the one who are used to come to our digital sessions, BLUMORPHO is especially dedicated to drive innovations strategy, but also operating innovation program that we are designing ourselves to address a main challenge, which is scaling what matters. Health is definitely part of that. And the main objective we have is indeed to support innovations, but also companies and organizations to get access to the right project with the right financing and the right innovation. And by doing that, we have raised more than 1 billion euros since 2016. So I think it's working well. But what is more important is to focus on what to do and why it's important to do it. So this is exactly the discussion we're going to have today. So as you know us, for most of you, we are working with startups, corporate organizations, and leading players. And definitely Iñaki is part of them. So we want to have a very interactive session, as always. So on the right part of your screen, you can have access to the question box. Don't hesitate to ask all your questions. We will do our best to answer them. We have already received a lot of questions. That's why you will see during this session today, a lot of questions will come. And Iñaki has been very nice because he accepted to take all our questions. So it's going to be very interesting, very informative. And of course, Iñaki, don't hesitate to share key information on your site. So for the one who do not know you yet, you are the director of, I'm taking my notes because I know you, but I want to be very precise. So you're director of health research, innovation and evaluation at the Basque government Ministry of Health. You oversee strategic planning, R&D policy, and the coordination of the Basque Health Research Institute via BioF. You are also very active in Health Technology Assessment International Association. And you are also active with WHO initiatives. Did I say it correctly? Did I cover main parts of your activity? Because I know you have a lot of activities.
Yes, mostly yes. And perhaps it is worth mentioning that I'm currently also the president of an international network that is dealing with horizon scanning. So it is more than 20 organizations all over the world with a specific location in Europe and Asia Pacific, with members in Singapore, in Malaysia, and Korea. Nowadays we have a university in Hong Kong, so quite active in terms of informing the healthcare systems on possible new technologies that are going to impact, and informing early on which would be the challenges. So that is called Euroscan IHDS.
Yeah.
And we have been proactively working on that for the last almost 30 years.
Oh,
so that means that
true.
we are becoming old. We are becoming old.
That's good, and it's good also because you don't only have an European point of view, but it's really a global footprint through this also activity of Euroscan. And thank you for adding this, because I think it's very important indeed. So actually, as I said, we are here to understand what are the main challenges that public health authorities are facing, what direction we could take in terms of innovation. We did receive a lot of questions from the different participants. So actually, the discussion for today will be organized in different parts. The first one will be definitely dedicated to the health authority challenges and your priorities. We're going to have another part more dedicated to AI, because obviously this is a booming disruption right now in terms of innovation. And the third part will be also to address specific case study to make it very pragmatic. And I know that you're very pragmatic on your side, Iñaki, so that's interesting. And of course, we can have more questions coming from the participants. If that's okay for you?
Yep, perfect.
Okay, great. So let's start. And for the participant, don't hesitate to ask your questions. So as I said, let's start by the strategic visions and priorities of health authorities. So the first question we have for you is, as a representative of health authorities, could you share with us what are the main challenges you're facing today and that health systems are facing today?
I think it is a very relevant question for many senses, and one of those it is related to one thing that has been claimed for so many years, and it is sustainability of the system, for sure. Yeah. So it is one of the main challenges. We have talked many times around the finite or the constraint of the budgets that we are having in healthcare systems, and right now it is a main concern. I'm not going to talk about France, but
please.
but we are at a very relevant moment in many countries, and that includes high-income countries for sure. And I think it is pretty relevant. Probably if we continue with the same with the same panorama in terms of expenditure and investment, probably we will reach to a moment in which systems will be fully unsustainable, to be honest. On the one side, it is the technological pressure. On the other side, it is the change in the landscape of most countries and in demographics. Also, something that we have created as high-income countries that is related to the new pandemics, and one of those it is obviously obesity and the new type of lifestyles, and specifically the lack of physical activity in some populations, and also the one thing that is also related to demographics, that is aging population. That I'm saying that is a success, but also it is a challenge to systems. And the last one would be related to that we cannot say that we are local anymore. So it has been claimed for many years that we close borders, and the genetics of our population is well known. No, we are global right now. I think the pandemic put the point in which we cannot consider anymore a single country healthcare system, but we have diverse populations, even in high-income countries, with the diverse characteristics, genetic characteristics, and diverse needs on the one side. Also, in terms of climate change, it is another challenge, and that relates also to many things that will be posed in the future. It is non-deniable to see that in high-income countries we have tropical diseases that were not in the past, and we will be need to deal with them. And finally, climate change also is bringing other challenges to the healthcare systems, and those are related to the episodes that we are suffering. So rains that are not been seen in centuries. Sometimes problems with freezing. Sometimes problems with obviously in summertime in the center of many countries. It is a huge problem, and also that is increasing the mortality and the morbidity. So those are things that were not in the past, and nowadays we are need to face.
The heat waves that we are suffering also during the different summer period. So a lot of challenges actually. More than we used to have. It's a combination more than we used to have in the past.
No, and I think one of the things that we are not proposing is new formulas that are now probably useful in terms of attaining with those challenges, and I think it is we are using old formulas, and those are not acting anymore, or they are not they are not going to be successful anymore, for sure.
They're not aligned with the reality we're facing now, actually.
No, no, it is true. It is true. So we need to find other type of solutions and other type of ways of approaching the problems that we are facing right now.
So that's good that we have this discussion, and we can launch an innovation program on this topic, because this is something which is needed. So it's good to start the discussion.
Chinese say crisis is opportunity. So I think it is a good moment for many reasons. and one of those it is that probably the maturity of technology right now it is higher than a decade ago. We were commenting today with the providers of services in the Basque Country, and it is true. It is we have other tools that we hadn't in the past, but we need to be sufficiently clever in terms of using them for the sake of the systems.
And this is the implementation, which is also a challenge. Iñaki, when we prepared this discussion also, and the previous discussion we had also recently, you highlighted this study, and I think it might be very interesting to explain a bit more this analysis performed by the Imperial College London in June this year. Maybe you want to share a bit more information about this.
Yeah, I think it was a very honest analysis of the healthcare system in the UK, and also which were the I would say the key aspects that were related to the bankrupt of the NHS in the last years. Obviously, one was related to the lack of investment for some years. Another thing it is not anticipating. I think it is using all formulas and not anticipating what is supposed to come. On the one side, it is the health systems in the world, especially in high-income countries, have been quite successful in maintaining the people alive. So, but on the other side, they post other things. That is the quality of life and the life expectancy has expanded. People that died much earlier nowadays, we have them, and some of those they are living longer. For sure, and but that poses many issues. One of the things that Lord Darcy was posing was related to the type of investment. That the type of investment has been quite located in healthcare and not health as a whole. And I think it is important to say. And promotion, prevention haven't been in the focus of the health systems, and we have been concentrated in being healthcare systems and not health systems, and we have been concentrating in disease and pathologies and not on health. Probably that has been part of the disaster. I wouldn't say disaster because I would say that is, once again, it is a success, and on the other side we have sufficient maturity of the technology in terms of providing new solutions. But this statement that was done by Lord Darcy and his team, and he was saying, however, only a fraction of investment currently targets community-based data-driven models. Hospital spending still accounts for over 60% of health budgets. I would say that is more even. If we account not just hospital care, but also the cost of drugs and other things, we have been pretty much concentrated on what it could be trying to solve the problems, but not going in depth to the problems. And I think it is tremendously important. On the other side, it is the cost of personnel and health professionals has risen a lot. So main drivers are new technology. It is the cost of personnel and demanding more health professionals, and also something that we have done with our citizens that is related to we have precluded to the citizens to look at things in reality not related to health outcomes, but related to the immediacy of healthcare. So it is having things closer to your place and being faster. And this is a society that has been very demanding. But on the other side, of the offer, we have increased the demand. So it is, and when you increase the demand, it is something that is exponential. So it is you are not going to cover all the aspects, all the things, if you increase the on the side of the offer, because the demand will be infinite. So we need to do things in another way for sure. And in the report from Lord Darcy, they were proposing different types of solutions. One it is technological, and I wouldn't say that is technology is the solution, but first of all we need to look at the problems. And what Lord Darcy was posing, it was from analogic to digital, from hospital to community, and I think it is important. So it is putting the effort in much more going to community care, and also because that also diminishes the cost of the healthcare, and also from pathology to prevention. And I would say that they were not even in the correct path, because I would say that is much more effort, not even in prevention and early diagnosis, that probably that diminishes the cost of the healthcare systems, but also to promotion. And once again, it is not talking about disease, but it's talking about health. And unfortunately, one of the things that we were discussing last week also internally, it is that one of the things that we are not doing in academia, it is that most of the schools of medicine, schools of nursing, and other health professionals, they are trained to identify pathology and to treat pathology and to rehabilitate pathology, but not in reality. It is well taught how to deal with health and being well. So it is, and I think it is something that we need to work also with health professionals, to try to work with them on the area of health promotion, health prevention, and also to identify which are the good habits that were in some way well taught, but I think we need to be back and probably create evidence in this sense.
So as you said, it's not healthcare systems, but health systems, where the focus more on staying healthy, not to go to the hospital.
Yeah, I think that it was in many countries in the world, they changed the name Ministry of Healthcare to Ministry of Health, and that was the case also of us in only a decade ago. But seems to be that we are still not well embedded in that concept, and also that poses another challenge, that if we are not embedded in the concept, it is that we are committing the same I would say failures that we were committing in the past. So I think that is part of why we are at the moment, and why the near future is not looking at the very best I would say way.
But as you said, let's turn this challenge into a good opportunity.
Yeah.
That's the point, exactly.
Otherwise we will be in other positions. If
exactly.
You see, probably we wouldn't be here.
Absolutely. So if you want to summarize a bit, what are the most urgent needs today to address? Because as you said, we have a challenge of budget and basically investment to make this change of paradigm from healthcare to health. Technology could help, digital solutions might help, but what are the top priority right now for you? Probably,
well, if we go directly, it is budget constraints for sure, and on the other side, it is as I was mentioning at the very beginning, it is recently there have been some papers that were saying technological solutions are posing challenges to systems because the increase of costs are among 6%, and bearing in mind how countries in their GDP and how they are increasing the GDPs, they don't match. So it is if we look at for example high-income country with that is one of the I would say big economies in Europe, like Germany. Nowadays we are in increasing the GDP almost zero. So it is 0 to 1. In those economies that are doing well, we are around 2.5. Perhaps we can say 3. So it is, if the technology is posing, instead of proposing solutions, is increasing the pressure to the health budget. That is clearly one of the challenges. Other things are part of the success, as I was mentioning before. So it is well, perhaps not in the case of perhaps this is something that they are not going to be fear about. And sorry if there are some people from the US, but life expectancy is increasing all over the world, except perhaps the US, which we are seeing that the life expectancy is going down. But life expectancy is related also to other needs, and we need to look at elder people in another way, because otherwise also that will be a further challenge. And another thing that is important, it is disparities. It has always been a challenge, but also even right now in high-income countries, disparities in access to health and also disparities in socioeconomic characteristics that they influence both quality of life and life expectancy. I think it is something that is a main concern. So how to provide a healthcare system that is that provides justice in terms of access and in terms of provision, and on the other side that covers all the things that are needed.
So you do have a very challenging job currently right now. So how do you do? What direction are you taking to address those challenges?
I was saying that it was a joke, and I was saying that you can decide between fear or death. So this fear of death, and right now I prefer fear. So this I prefer being honest and thinking, well, those are the challenges that we have, and probably those challenges have some answers, and we are very lucky. We are very lucky because we have most of the things to do something that could be impactful. Technology is much more mature. We have more data. We have more data than ever. We have also very skilled professionals, and also we have a society that is waiting for those solutions. So I think partly it can be answered by the proposal that has been done by NHS England for the next 10 years, and it is following the report from Lord Darcy, and they were saying, well, from analogic to digital, sure. So we need, in most occasions we have been doing, and we have been making decisions with uncertainty, and nowadays we have sufficient data in making those decisions much more based on evidence, and I think we need to use that. For that, we need obviously to put the correct questions and make the correct challenges in the plate. Second, changing the paradigm. Most of the healthcare systems, and nowadays they are pressured around things that are not related to outcomes, or they are surrogated outcomes, as we as epidemiologists say. We are looking at waiting list. We are looking at access to first visit. We are looking at things like the length of stay. I'm not looking at, in most countries, we are not looking at realistically to outcomes. There is a movement on nowadays to value-based healthcare. I'm pretty much on that side. So we need much more to look at value, but also we need to transmit that to the society. So we cannot say to the citizens that they need to look at waiting lists, length of stays, and lack of professionals. That is, if you go to most of the titulars and most of the things that we see in news and mass media and in general, they are related to that. But I'm not seeing that in many newspapers or mass media or radio, TV, so other or on the web, talking about how we have changed in many of the diseases, the life expectancy on the one side and the quality of life.
Quality of life, yeah.
Concentrating on those two things. So it is outcomes on the side of interest of patients and professionals. So it is what is called right now PROMs, PREMs, and PROMs. So it is patient-related outcomes, patient-related experiences, and clinicians-related outcomes. So it is looking much more at that and measuring the systems, the system performance based on. So we cannot say that we are going to look at value and the I would say the combination of investment and outcomes, but also we need to think that we need the way of measuring the healthcare systems need to be related to that. So yeah, value it is important, but also we need to I would say analyze the performance of managers on the basis of that, and not on the basis of length of stay and other things that are much more related to a structure and processes. So probably changing the paradigm. Second thing, it will be as the report from NHS England, they were saying, hospital needs to be there. Sure, there will be acute process, chronic processes that are going also to be re-acute, and we need hospitals, and we need hospitals that perform well. But on the other side, we need to concentrate much more downstream. So we need to concentrate much more on the community and why those things happen. And also we need to concentrate on finding solutions at the side of the community in a very proper way. So this enhancing and investing much more on community care, on probably community nurses and community physicians that are landing much more on the land, and also they are anticipating issues, but also based on data. So it is not that saying we need more primary care physicians, so we need much more community nurses. No, it is not the case. We need to understand much more the dynamics of pathology and why we go from the health status to a pathological status, and which are the tools that we can use in terms of that. And the last one, it is obviously related to the proposals from the report and from Lord Darcy, that it was from disease to prevention. I would go much further. So it is not just disease to prevention, but disease to promotion. So it is anticipating the problems, not identifying the problems early. Probably identifying the problems early reduce the cost to the system, but not creating the problems. So we have been having a huge problem in summertime in some regions in Spain with fires, and one of the things that is we need more people that are working against fire. So this and those that are on prevention of fire. But on the other side is why fire is occurring. So this one thing, it is climate change. Another thing it is how we anticipate that a fire does not occur, or if it occurs, produce the less damage possible. So I think in health system it is the same. So this if we go in depth to the why problems happen and why there are transitions from a patient that is chronic and they can evolve in a chronic status, or they go more in acute status, and that diminishes the cost. Another thing that we need to do it, and it has been identified by many systems, it is that almost 30% of the 25 to 30%, and it was published in New England Journal of Medicine. It is not because I'm saying, almost 25 to 30% of the expenditure of healthcare systems, it is waste, and we need to identify why it is waste. So this
wasted, meaning that it's not used and we are throwing it away.
Yeah, it is. First of all, because we are using some solutions that are probably they are not going well in certain patients.
Okay.
It is because we are using certain solutions in indications that should not be. Also because we are not procuring in the correct way. Also,
so what the percentage you said is wasted?
It's 25 to 30%.
Oh,
so
wow,
I can send to you because it was an analysis that was done 10 years ago in the healthcare system in the US, but there was a similar report from OECD that was posting that almost 25% of the budget of the healthcare systems can be used in a better way.
Yep.
Something could be related to fraud and other things, but most of the things it is not using the correct solutions and probably not analyzing. In the past, it could be admissible because we had them data, we had a lack of data, but nowadays that we have data on that, I think we have lack of analysis and lack of decisions.
So we'll come back on this topic just after, because we want to speak about data and AI for sure, definitely. But so you know what we're going to do? We're going to just answer very quickly some of the questions we have here before going to this topic. So just quickly, so those priorities, are they shaping and changing your innovation agenda today? And at BioAF, how do you do that? Are you working more with innovative company, corporate? How do you operate?
What we are trying to create it is and yesterday we were announcing that in Bio Spain. So this Bio Spain it is the biggest area of healthcare system in Spain, and well, I would say it is something similar to what Medica it is at a different stage, obviously, in Europe, but it is creating an ecosystem in which there is a collaboration between the different actors. So we need the help of all of them. On the one side, it is the healthcare provider, the one that has the money. So it's the ministries of health. So it is the administration and obviously the governments. Clusters of companies. They are tremendously needed. So it is because they have the knowledge and all the views around the healthcare system. So we need a combination of public-private. So this for sure, and we need to understand the two worlds. And I think most of the solutions should come, or they will come from the interaction between the two worlds. On the one side, it is the healthcare system, and on the other side, the productive system and innovators. And the fourth one, it is academia. So it is the fourth helix. I think it is tremendously important. So it is creating an ecosystem in which all the actors collaborate. So it is society, healthcare system, government, academia, and I would say the producers. And this is something that it is nowadays not. We were discussing yesterday. How do you envision the collaboration in public procurement provision? In the past, it was a need. Now this is a must. It is a must. It is a must. There is knowledge that is lacking in the healthcare system, and there is knowledge that is lacking in the innovator side. So we need to work together in terms of providing solutions to the challenges that we are facing. So first of all, it is creating that, and specifically, as I was saying, and this is with the next question that you are putting in the slide. So it is a specific approach of the Basque Country, or is more global approach. As I was saying, this is a formula that we are applying locally, but this is a formula that needs to go globally, because otherwise, as I was saying, we can try to put some kind of I would say barriers to the sea, but the sea is immense. And once again, we are not talking about local problems, but global problems, and going to hit us in many senses.
What you're saying is actually music to my ear, you know. So this ecosystem approach, this is something that we are working on. Like this is the roots and the DNA of BLUMORPHO for sure. And you ask for a change of paradigm. That's the best approach indeed to do it. So very interesting to keep going.
And also challenging the innovators on the side of they have been pretty much focused, probably because of the market and the market needs. But I think we need them to be focused, as I was saying before, perhaps less on continuously working on the side of prevention for sure and early identification. This is something that they are already doing, but also on key elements on promotion. So this on identifying early and precluding to a system that is working on health and not on disease. And this is something that we need to do together.
And the question is, do you have already a list of solutions you're looking for? We received a question already about point of care. Is it something in diagnostic? Is it something that you are looking for, that you need to make this change of paradigm and to make the evolution of the health system?
I think we need something that help us understanding the dynamics. So it is, and when I'm saying the dynamics, it is there are systems that are being quite good in static analysis of the situation. So this, when I was studying epidemiology, it was transversal studies. So we have the photo right now, and based on the photo that we have, we plan. But I think we are not sufficiently sophisticated, and probably we with the solutions that we are having in the healthcare system right now, we have more keys to understand the dynamics, and understanding the dynamics will make probably making some kind of more dynamic planning. So it is understanding why things are happening and which are the key elements in those changes also helps us in transforming the way that we are planning, and that definitively I think it is crucial. Identify much earlier, so it is probably the area of biomarkers and combination with other type of data. It is something that we are looking for. And also the combination of things in terms of different type of data, not just the data that we are having from healthcare systems, but data that is the environmental exposures, lifestyles, socioeconomic conditions. So all those, the combination of all those aspects and how they interact and how they explain the dynamics of healthcare systems, because otherwise we are going to arrive late. So what we are doing it is putting bandages when the heart is done.
This One Health approach and breaking down the silos, basically, as you said.
Yeah.
Two questions about that. So on this side, as a health systems, is it possible for you to collaborate with innovative company? And would you need also to work with large private companies as well? But I think you started answering that because you said that you need an ecosystem approach.
Totally yes. So this I was saying that in the past it was a need because probably we were not able to solve the problems by ourselves. So it was a need. So this well, we were trying to do things and there were some challenges that we were not able to attempt, and we were looking at innovators and saying, well, those are the things that we are having. Now this is a must. It is a must. It is a must. So it is. I'm not looking at systems that they are not collaborating with companies from the very beginning. So it is, and this is something that was launched also by the European Commission regarding pre-commercial procurement that was not very successful.
Yeah.
Probably because systems were not already mature to share with the innovators which the challenges were. So it was based much more on the side of, well, come to me with your offer and we will try to validate on our system. But I think it is the wrong way of acting. I think we need to work much more on the side of identifying the needs of the systems and telling innovators, those are my challenges.
Exactly.
How you can solve them. So it is working together in reality. So it is, and those are my challenges, and I can prioritize them. This is the first, the second, the third, the fourth. So I have much more focus, and it is true. So it is there was a film that was when East meets West, and I think it is tremendously necessary because there are two different worlds, but they need to communicate. So this communication is crucial in this sense. And another thing is, you were saying big companies. We need big companies because if we create sufficient number of innovators in an area, they can be escalated. And we cannot do it in regions, we cannot do it even in nations, because we need to go globally. And for that, we need companies. So this, first of all, we can test. Second, we can share the challenges. Third, we can provide solutions at the local level, I would say, but they are going to be global. But we need them to be escalated, because when I was saying that they are going to be global, and we are living in a global society. That is clear. That is clear.
Yeah. So the limitation would be to go global. That's also what you need to make it happen. Right?
We cannot do it. We cannot do it. There was an eternal discussion of, well, do we need big companies in countries, and they will say, no, we will produce by ourselves. No, come on, that is not doable. So I think we need
that's very clear.
Single agent in the I would say in the chain needs to play a role, and any of us, we need to know which our role is, and clearly for big companies the role is escalating and making that more sustainable. So it is that the solutions could be launched globally, because we will be in need of a global solutions, because otherwise they will be back to us. Yeah. And on the other side, we need a good number of innovators they are not going to be big companies, perhaps one of those or two, but on the other side, they are going to work for big companies. And on the other side, we need systems that play the role of identifying realistic needs, and not something that is put from the side of the push, but making much more stronger the pull.
Clear. I'm seeing that we are really running out of time, because we just have 15 minutes left, so we're going to have to cover the different questions faster. Sorry for that, because the discussion is very interesting.
I will try to be shorter.
But it's very interesting, and you really highlight the key challenges. But the question also is business model, because you said you want to change the paradigm, evolving from healthcare to health, from treatment to prevention. We need budget for that and financing. Is it a business model something that you have already started thinking about, or is this approach by bringing the solutions will make possible to make emerge the right business model?
Yeah, one of the challenges is who pays for that, who pays for the fees, who's going to do those things running. If we look at the healthcare systems, they are not going to pay for that, but we need to have other actors paying for that. That is the key element. We look at that during the pandemic. So during the pandemic, we were looking at other type of measurements. We were looking at productivity. So if there is no health, there is no wealth. If we are not opening and finishing with the lockdown, there will be no economy, and then the world is not running. So, and I think we need to have other formulas in terms of measuring the success of healthcare systems. Probably right now, the main paradigm, it has been the comparison of different solutions in terms of the investment and the results, but it's not sufficient. Nowadays, there are some other type of measures that have been proposed related to productivity adjusted life year, for example, like PALIS. And but then the challenge is, who is going to pay for productivity? The healthcare system, we are paying for health. So we are paying for quality of life, or we are paying for life adjusted life years, or quality adjusted life years, or we are paying for increasing the length of life. Who is going to pay for productivity? Probably it is companies, it is governments, but other parts of the government. So it is the Ministry of Industry, the Ministry of Economy, because if we have people, if we are persons that are productive, the economy of the country will improve. Yeah. So on that basis, perhaps we need to think out loud and proposing new models of how health systems and not healthcare systems are going to be subsidized, or are going to be budgeted, or are going to be to obtain funds for investment. So that is a shifting paradigm that I don't know if someone has thought about that, but I think it is the key element.
The key.
And I think the society needs to be conscious of that.
Yeah, that's part of the key agenda indeed. So financing is definitely also an issue, because we need to make the move in terms of business model with something that provides also economic return. So financing would be an interesting approach, right?
Yeah, financing, I think it is, as I was saying, perhaps we need to think about that perhaps those that are going to invest for health, perhaps they are not going to be the ministries of health, but perhaps some others. But also we need to think about that financing wouldn't be an issue if we will find new solutions, because probably there will be a return on investment. So this something that will run and that will go round. So this
evolution of business model related to it. Yes, I'm going to have to accelerate a bit. So this is also something that we discussed together, and public-private partnership, blended finance, all of that could be interesting. As health authorities, is it something that you will consider?
We need to find money anywhere. So this if we need to provide, so the combination of public-private funds. There is one discussion. So this public provision of health, but public-private partnership, public-private partnership in terms of the investment, not on perhaps of the healthcare, but on the side of providing solutions for sure. So this and in this sense, data that is coming in most cases from public provider of services needs to be shared with private companies in terms of getting solutions. That will diminish the cost of creating the solutions, the cost of validation, and also the return on investment.
Thank you. That's pretty clear, and that's opened very well also the discussion for the weeks to come and months to come, by the way, on the action we are running. I wanted to make a short point with you about AI, because you mentioned several times that we need to maybe be more proactive to better anticipate, to change the paradigm from silos to a more ecosystemic approach. So could AI be the breakthrough innovation to those challenges? Is it something that you're assessing right now?
Yes, we are testing in a case in the Basque service. We are testing solutions in I would say in a sandbox way. So it's obviously a safe environment, and this is something that is very interesting. But I was in the Health Data Forum, the International Health Data Forum, recently in Cardiff, and I was hearing also to big companies that they were saying, yeah, AI is interesting. Even those that are providing AI solutions, but we need good data, and we need systems that are providing to us with data. If we are starting with rubbish, we will finish with rubbish. You are not going to finally have good solutions if you have not sufficiently curated data. And this is something that companies have understood. In the past, even I know that there was a project from Microsoft that was Dr. Watson, and
Dr. Watson, yeah.
And mainly one of the key elements for non-success was lack of good data.
So you used Dr. Watson, you tried it. This is something that you tested yourself, but what was not good enough was the lack of data and it was
the lack of data and the lack of accurate data. So
accurate data.
This is something that we need to work together. So where we are having good points and nice success, it is on the area of diagnostics, in which we have very objective data on biomarkers, very objective data on images. So and also that creates less fear to the systems, because what they are, instead of artificial intelligence, what we are doing is intelligence augmentation. So this the technology is creating a landscape by which we can do things faster, because the technology that we are producing right now, the way that they are processing it is faster than the human being, and on the other side, it is I think it is also trying to find ways by which using artificial intelligence also could help us creating the data. So
absolutely.
I think there is sufficient space for artificial intelligence, but we need to accommodate which the expectations are and in which areas we can live comfortable. So it is true that we have been claimed that in Europe we are very conservative and we are putting many barriers. But on the other side, the healthcare services are pretty much looking at guarantees, and we don't want errors. And we have learned from errors. And I've seen some solutions that have been launched in the system that finally they are not proposing solutions, but increasing the current mistakes that we are. So it is enhancing or even making more exponential the errors that are the mistakes that are in the systems. And this is
interesting.
But this is something that I shared also with some innovators and big companies only a couple of weeks ago, and they were at the same page, and I was very relieved, to be honest.
So one of the limitations right now of AI is definitely the lack of accurate data, but also sometimes the use of those solutions might generate more mistakes than really help. So we are still in the learning cave, basically.
Yeah, I think there were both. On the one side, there is that probably we are not challenging the artificial intelligence with the good questions, and on the other side, we are not giving the artificial intelligence solutions with the good data. So this and it was funny because the Health Data Forum finished with first data, then artificial intelligence, and I added to that quota first questions, then data. So this we need questions that require data. We need to have good data, and then we need to test and enhance our capabilities in terms of analyzing those data and producing solutions on the basis of the tools that we have. And one of those definitively is artificial intelligence.
So data are key. One of the challenges most of the time to give, to get access to those data and to exploit them, because data ownership is definitely a big challenge. We have discussion already together on that, so we are working on some solutions, but is it something that is a key concern for you, and would you be open indeed to engage into this kind of data sharing or data exploitation processes? Well,
it is part of my nightmares.
Sorry for that.
No, it is a good nightmare. So this sometimes we are saying that is well, I have nightmares, but those are nice nightmares. So it is true that it is a challenge right now, but well, in the case of a country or region, we are exposed to the new regulation in Europe and on the secondary use of data and health data precisely, and we need to move to the use of any public data needs to be, in the case of the health, needs to be available for anyone in 2029. I think we need to be much earlier, and we can do it much earlier with the technology that we have. But we need to have we need to have human intelligence, I would say. Yeah. And in this sense, we need to use the data for well, first of all, we have a change in paradigm. Up to now, the regulation in Europe has been quite a step, perhaps Finland and some Baltic countries that have been much more open. But it has been, the data is owned by citizens, and they have the right to say, well, in principle, there is no use of that data if it is not with an informed consent. It is true that nowadays the new regulation is saying that if you do not opt out, we can use your data. But we need to define the use cases. In this sense, we are working on that. We are proposing use cases, and also we are proposing also, I wouldn't say pilots because I dislike the case of pilots, because for me, saying that we are piloting, it is that we don't trust on the things that we are doing. I think we are doing right now examples.
Yeah. First use case.
Yeah. So this use case. Yeah. So finally, it is we trust on the use cases that we have chosen, and we will go in depth to them by using examples that could be escalated in many senses. So I think
maybe we could jump to those cases, because I think it's good to explore specific challenges to illustrate what you just said. Because when we started the discussion just about 1 hour ago now, you highlighted the challenge of pandemic. and the pandemic has been a major impact. Is it still something at risk? Is it something that you're considering also in terms of solution to be fine in terms of data, AI? Maybe we can cover this topic just as a conclusion, because we want to understand what is the situation actually, and what are the threats related to that.
Definitively, yes. So probably people will say, well, COVID is not an issue anymore, and perhaps they are right. With the probably with the evolution of the viruses and coronavirus, probably we will go to something that will be not even an epidemic. It will obviously not a pandemic, but there will be other pandemics that are coming. So pandemics are a big issue. As I was saying, we cannot say anymore that we are local. We are saying that we are global. Things that were happening in tropical countries, malaria, dengue, and other type of diseases that we have them right now here. We have mosquitoes in the center of Europe. So we have the tiger mosquitoes, we have the albopictus mosquito. So so the vectors are here. We have nowadays also identifying different types of flu and different types of flu that are related to some animals, and they can be converted into problems. So there's the birds flu. It was something that I was talking, but we have H1N1 in some birds that have been identified nearby. So there will be a moment in which the vector will jump, and we need to be prepared for that. So it is something that is in the past. Once again, we can have fair men, and they can help us. I think we need to have the tools in terms of anticipating to the things, and not looking at the we need to produce, when it was the pandemic, we need to produce PPIs, so it's personal protective equipment and so on. No, perhaps they are not going to be needed if we do things well. Yeah. So I think we need to control the key elements, and once again, the technology will be part of the solution. There is, but if we are not using, we will be really stupid.
No, we cannot say we didn't know. So to better anticipate, you said technology for sure. Access to the real and relevant data will help to manage the risks. Working also with other players. You mentioned a lot of aligning also with other players, like in One Health approach.
We cannot do it alone anymore. So this it will be once again stupid if we do things thinking that governments, healthcare systems will do it by themselves. It is impossible. We need global investment. We need I would say the good brains, so good human intelligence, and the help of artificial intelligence and other type of solutions in terms of bringing that to the public, and trying to anticipate. So this anticipating will be the key.
The key point. Very good. Yeah. So actually, thank you very much, Iñaki, for all those sharings and insights. I think it's covered very well the topics that we are working on at Financing Health Innovation. Just to explain a bit more about these actions, is very dedicated to the co-construction of solutions fitting with the needs of the health players, and basically starting from the need and working on strategic collaboration between all those different key players together, structuring a value chain with, as you said, measurable impacts and coordinated actions, meaning that if we do that, we can very potentially change the paradigm to measure the outcome and not the checklist of what has been done, but really the impact. And because those models will be designed to be very positive in terms of economy, to engage with financial players with the right financial models. So thank you very much for your time, because today you make it very right. We have a lot of challenges, but we have, as you said, a lot of opportunities. So this is what we are here, and that's why we are very happy to have you with us today, and also starting working on this program. For people who want to know more, you can contact the team, Radia and Olivia, very active on these topics. And I wanted to thank you all, because I think it's already the time to close the session. So thank you so much, Iñaki. Very, very interesting discussion.
Yeah, thanks for inviting me, and it has been a pleasure. As you have seen, we could be talking for hours around these topics, and I think it is an excellent moment, because I think we have the technology and the systems mature enough to capture the need for an ecosystem.
So I don't know if we have time for questions, because I see some questions coming now, but I cannot find them, so that's the problem. But meanwhile, I just want to also highlight that when we are discussing about Basque Country and the Ministry of Health of Basque Country, a lot of people agree to say that you are really paving the way of innovation. So what you're doing is a good example, and I can tell that a lot of industrial players are really looking for what you're doing. So I think this is also a key messages I want to share with you.
Mm-hmm. Yeah, thanks, and that seems to be that we are doing in the right way.
Absolutely. Thank you so much, Iñaki. We're going to close now, and for the participants, if you have any questions, don't hesitate to contact us. We will follow up, obviously, and we will keep you posted for the next actions related to financing health innovation.
We can do another webinar another day.
Thank you so much, Iñaki. Thank you so much. Talk to you soon then.
Bye. Yeah, take care. Bye-bye.